Cancer vaccine. Many countries are doing research on this cancer vaccine, especially the Russia, America, and China. As for these countries, they got initial positive results, and shortly we may get this vaccine for cancer. But is this true, or it's just a business like a COVID vaccination? Coming to this vaccine, so vaccine is not a new concept. It is there for the past 230 years. The first vaccine which was invented is a smallpox vaccine in the year 1796, almost 230 years back. But at that time, there were no syringes. So how they were giving this vaccine? They were creating an wound. That is, they were scratching the skin and producing an wound. So in that wound, they were inoculating this infected material. So first vaccination was smallpox vaccine. After the invention of syringes, that is after 1885, so many injectable vaccines were invented. So like vaccine for cholera, vaccine for plague, vaccine for typhoid, as well as for rabies. Now at present we have more than 25 different types of vaccinations, human vaccinations. So question is, are they really useful? These vaccinations, are they really useful or not? The vaccines which were invented earlier, so basically they were the dead viruses. So they were safe. No chemical was there in that vaccine. Only either dead virus or bacteria was there. So that was safe. So but now the vaccines which we are using now, later vaccination companies started increasing. So they have to survive. They have to expand their business, for which they were producing vaccination in huge mass. So when large quantity of vaccinations has to be produced, they have to be stored and they have to be transported, for which they need to add certain chemicals like adjuvants, stabilizers, as well as the preservatives. So the dead virus or the dead bacteria is safe, but the chemicals which are being added nowadays, that is the adjuvants, stabilizers, as well as the preservatives, they are chemicals and they are unsafe. So now this Russia is claiming that they have vaccination for colorectal cancer. That is Enteromex is the name of that vaccine, which is effective against the colorectal cancer. So what this vaccine is doing, as for them, this vaccine goes and infect the tumor cells, colorectal cancer tumor cells. It will infect, and there it starts multiplying. These virus, four different types of viruses will be there in this vaccine. Which will go, these virus will go and start multiplying in these tumor cells, resulting in rupture of these cancer cells. Second thing is, these vaccines will train our immune system so that our immune system goes and fights against these cancer cells. So this is what the Russia is claiming. So one step ahead of Russia, America is claiming that they are developing a vaccine which is effective against almost all the cancers. That is, it's an universal vaccine which can fight against any cancer. But in my opinion, so I'm telling my opinion, in my opinion, this is highly impossible. So vaccine against any cancer is impossible. Explanation for my opinion. First thing is, what they are claiming is, this vaccine will go and stimulate our immune system. It will train our immune system. But immune system what we have, it is from the nature. It's the most smart system of our body. It can recognize almost, it is 1,000 times smarter than our imagination. So such a smart system we cannot train. Second thing is genetic mutation. These cancer cells keep on mutating. So like a COVID, what we saw in COVID. So we got infected with the COVID, first wave of COVID infection. At that time, we started giving vaccination. So because of this vaccination, the virus started mutating, and we saw the second wave, third wave, and fourth, like a Delta virus, Alpha virus, what we saw is because of the vaccination. So like that, we start giving vaccine for the cancer cells start mutating and producing more severe, different form of cancer and severe form of cancer. Third thing is, cancer is a multifactorial. It's not because of any one factor. So many factors, many reasons will be there causing this cancer. So again, specific treatment is not possible. Specific vaccination, again, it's not so possible. Fourth thing is, we have more than 200 different types of cancers. So now this enteromics, what they are claiming is against the colorectal cancer, one type of cancer. So we have more than 200 different types of cancer. That means to say we need to receive more than 200 different types of vaccinations, which is not possible. Next, fifth thing is the companies themselves never claim that this vaccination is 100% safe. Not only this vaccine, for any vaccine, the companies will not claim that it is 100% safe. Not only that safety, and also they won't claim that it is 100% effective. That means to say, you may get some complications because of these vaccines, one thing. Second thing is, so it's not 100% effective in the sense, again, you may get infected, you may get the cancer. So with these, even after receiving this vaccination. Sixth point is long-term complications. The companies, the pharmaceutical companies will only mention about the acute complications, immediate side effects. So, but they won't mention about the long-term complications that may happen after so many years. They may not be mentioning, even though knowing they may not be mentioning, or even they are not aware of these long-term complications. Seventh thing is the tuberculosis. For tuberculosis, where an vaccination, that vaccination is still now we are giving this vaccination, that is the BCG vaccine. So this BCG vaccine was invented more than 100 years ago in the year 1921. So for the past 100 years, we are receiving this BCG vaccination for to prevent tuberculosis, but still this tuberculosis is gradually increasing. So that means to say, totally what I mean to say is, the vaccinations cannot give you health. They cannot improve your immune system. So what is the vaccine? Vaccine is nothing but, in my opinion, vaccine is nothing but just it's a business. So what are we supposed to do? So instead of going for these vaccinations, so first thing is try to find out exact cause of this cancer. So our parents or grandparent is having some, if you have any family history of cancer, then what could be the exact reason? So try to find it. If you know the exact reason of a cancer, definitely we can prevent the cancer by 100%. One thing. Second thing is we need to improve our health. How to improve our health? Lifestyle modifications. First thing. Second thing is changes in our food habits. Third thing is changes in our mind. So lifestyle modification, changes in our food habits and changes in our mindset will definitely prevent any cancer, and it can cure any cancer also. Third thing is, so we cannot train our immune system, but definitely we can support our immune system. If we have a good health, definitely it improves our immune system. So this is just my opinion, and in my opinion, no medicine is safe, and this vaccine is nothing but a type of medicine. So instead of relying on these medicines, just improve your health, which can prevent any cancer as well as it can cure any cancer. So be happy, stay healthy. Namaste.